Okay, thank you so much, everybody. I really like this format of having research and scientific presentations and then a patient story. And I'm so delighted that I have a connection with Dr. Magro in the sense that she did her residency at Mass General and now I work at Mass General. And that is very comforting to me. So my talk today is going to be sort of threefold. I'm going to tell you my experience with my son who was diagnosed with Degos disease at Mass General, my really limited engagement with Degos research, and then actually I think it would be helpful for us to have a discussion, if we could, about what patients really need from the Degos network or this effort in order to become more engaged in research efforts, because I have some ideas, but I'm sure that there are folks in the audience who have good ideas too. So my story can everybody hear me? Yeah, okay. So my story is that in 2004, my typically developing, really healthy 5-year-old began to have severe headaches and severe stomach aches. And we indeed went 8 months before a diagnosis, before any lesions presented. And then I believe, and Patrick Whalen, who took care of my son Jack, can correct me if I'm wrong, but it was about 8 months before lesions, and then in the 9th or 10th month, Jack died. So the journey from the first headaches to the diagnosis was one in which there were a lot of subspecialists involved. Thank goodness that Patrick was involved, and so many incredibly dedicated and really smart people at Mass General Hospital. I will say that I think that one of the reasons that he was diagnosed was because there was a very large meeting with many of his subspecialists and all of his subspecialists, a pathologist, and the neurologist, the pediatric neurologist who was involved in his care, did know about the 1963 case that Dr. Magro just mentioned, and also had treated a patient in the 1980s, right? So I know that I spoke to somebody last night who said it's sort of, you feel lucky when you got a diagnosis, which is really counterintuitive, but it is very comforting to get a diagnosis, because then at least there is a focus. After Jack died, I was able to go and meet Dr. Zaboulis and Judith and her husband in Berlin, and gave blood samples and tissue samples to that effort. In 2007, Patrick and I organized the conference in Boston, in which there were many subspecialists and several patients. And there were some lessons that came out of that conference for me. Well, first of all, I will say that Patrick really took care of the scientific aspects of the conference. I had the patients meet with a wonderful psychiatrist that I had come to know and who had helped me and my family. And she talked about, the psychosocial aspects of and coping of living with a very serious illness. And I also asked a neuromuscular specialist who had worked with many patients in research to give a presentation and led a discussion about how to engage patients in research efforts. But two things came out of that conference for me. One is that patients really wanted a lot of time together to share their stories, to share knowledge, to get to know one another, and to understand more about the disease. So number one. Number two, what they really wanted was clear information about Degos that they could understand, that could help them to manage their symptoms and manage their disease, and that really applied to their lives. So I will say, after that conference, I kind of drifted away from the Degos efforts, and I began working at Mass General Hospital. So after my son died, I reached out to the chief of pediatrics and said there were so many subspecialists involved in his care, and thank goodness for that. But the care seemed to us somewhat fragmented, and it was hard for us to manage everything. Long story short, with the help of leadership, we were able to create a clinic at Mass General for children with complex medical illnesses that I now manage, called the Coordinated Care Clinic. A few years later, I joined the Palliative Care Service, so I manage that as well. And I also am the chair of the Family Advisory Council. So I work a lot at Mass General with patients, with parents of patients. And I have come over the years to see the value in collaboration between physicians, physician scientists, and patients. And that's why I love the way this conference is organized. And I think so many powerful things can come out of it. So Dr. Boehm had asked me to speak a little bit about how to engage more patients in research efforts. I have a few ideas. I will present them to you. And then I hope that you can present some ideas that you have to me. I believe there is a patient registry for Degos. I believe that exists on the website. And I think that is a first step. And I don't know, we went to dinner last night, and I spoke to a couple of patients, and not everybody was aware of that. And so I think getting the word out, even to this community of patients, is a really important thing. Secondly, is there a Degos disease advisory board that is made up of physician scientists, patients, I would even say genetic counselors, I don't know, palliative care specialists, that meet on a regular basis and apprise patients about the research efforts that are going on, and then hear from patients about what their specific needs are. That's another idea that I have. I am delighted that the speakers today, including some patients and some parents, will be able to look at a research protocol for a clinical trial that is going to take place here at the NIH soon, and I think that is a really powerful and wonderful example of patient engagement. I think that researchers can be very clear with patients about what they need from patients, what patients can help them with. Is it that really the focus is blood and tissue samples? Over my years working with parents at Mass General Hospital, I have come to realize that parents have expertise and skill, and that oftentimes there is a wonderful match between a skill that a parent has or a skill that a patient has and the needs of a project. So I think, is it that researchers need patients to fundraise? Do you need help in grant writing? Do you want us to go back to our institutions, the hospitals, the medical centers with which we're affiliated, and offer for you to be able to come and give talks? I know that people in the room, patients in the room, are here because they want to help. And then I think there should be a lot of opportunities for patients to be very clear about exactly what they need. And for many of us, it is a very simple need, which is information about whether other family members will be affected by the disease. And thank you, Dr. Zaboulis, for giving that information today. So that is really, in my view, just the beginning of a discussion, and probably not very profound ideas. But if any of you have experience in this area, or even patients who do have a specific need and hope that this collaborative will address it, then I think that would be beneficial. I think there are 3 minutes for discussion.
So thank you very much.
We do have time for questions.
I have to say that it needs an incredible strength, what you have done in your life. You lose such a valuable member of the family and then dedicate yourself to this work.
Thank you.
And I can imagine that you have done a lot of work presenting us so simply this story, and then you come with a very critical and clear question: do you need from us something? And I tell you my experience in Europe, and the answer is clearly yes. Because as far as a physician, if I try in Europe to develop registry, get samples, I have 8 lawyers on my head telling me you are not allowed data protection. Do you receive all the permissions possible? And I have one disease now that I think I have a solution, but the most patients are dying. And now they ask me to take the permissions of the daughters and the sons and the granddaughters and the grandsons. And I don't know where all these people live, if they live, and when you get them, they tell you, oh, what I have that from that? You say, no, it's important for other people. Say, I don't care. So what we learned in Europe is if patients initiate, if you say, I donate my specimens, I donate my data, I donate my lab, and there is a protocol of that where you sign and give it to the development of a registry, of a bank, of everything. Then suddenly all problems have been solved. There's no lawyer saying you are not allowed to. So I think this is a way to propose. The best way we want to go, both sides of the Atlantic, is to have a patient's board, to have such a document that we can give you, where it's saying, I give you for this period of time to live say for my life, this and this and this and this, sign, and I contribute to the research that we've done. If this will happen, it will be a huge step towards research of the disease, and we will breathe out making research and not being very involved in such documentation of non-documented things.
Mm-hmm. Thank you. That's so helpful. Yeah.
Anybody else?
I work with the Fish Bureau in Albany. There is, at a minor scale, a board of patients and doctors. They belong to Bernie's family. I believe he's the chairman of the board. He's through the statin scleroderma. And it's a start. So it's kind of like along the line of your thoughts and ideas. Maybe one day you could come and join and see how it works. So it is composed of doctors and patients and ideas are made there.
All right. Thank you. Thanks. Mm-hmm.
I'm one of the dermatologists here, and my main interest is in vasculitis, and this is a very rare, one of the rarest, not as rare as Degos, but I can tell you from what we have done in our field is that the patient came together and they created the Vasculitis Foundation, and that was really very important for different aspects to bring in the patient for multiple clinical trials, and also there is an online registry for patient network. So there is this data, recording and registry per patient that has already, so you have a model to follow if you look over the Vasculitis Foundation.
Okay. Thank you. Thanks.
Thank you. It is my pleasure to introduce our next speaker, Susanna McMahon from Johns Hopkins University. She will talk about vasculopathy and Degos, potential insights from systemic sclerosis.
Thank you.
Do you want to put it on your lapel? I think that works
I
best.
think that would be
Yeah, best. Do you need some help?